Did you have an accident and not right away did you feel bad, but 3 to 4, 6 months later, all of a sudden you start having chronic health problems and you've had the MRIs, the blood tests, you've done all the internist work, you've been to the HENT, you've been everywhere, and you're still left with 20 problems like vestibular problems, headaches at the back of the head, low energy, your neck hurts all the time. You find when you wake up in the morning you don't feel as well as you used to, fall into sleep as a chore, you don't get deep sleep the way you used to, and as a consequence you feel like you've lost 20 or 30 points on your IQ. Right here is the spinal cord. It exits the bottom of the skull and a hole in the bottom of the head called the foramen magnum. This is the most critical junction, which we call a choke point from a neurology standpoint, because every message that comes from the brain comes down through the spinal cord and then it exits a nerve at each vertebral level, and those messages go out to every cell in your body. You have 15 trillion cells in your body, and one cell every second has 1 billion chemical reactions, and all of it is coordinated through millions of nerve impulses that are passing back and forth through the nervous system. Now, because your head weighs 10 to 12 and it sits on this very small vertebra right there called the atlas, this area can dislodge and lock from trauma and can set the stage for chronic health problems throughout life. So if you're dealing with these types of problems, leave a message in the comment section below. We'll be happy to find you someone who specializes right in that area, precisely correcting it with no twisting or yanking of the neck. We use 3D imaging to ascertain exactly how it's out of position, and then we correct it back in its position. And the goal of the care is to keep the upper cervical spine clear of the pressure on the cord so the body can then over time mend, heal, and repair from the inside out. See, we've all been told the lie that when we have health problems, it's because we're lacking from something from the outside. So we take Advil, lisinopril, cholesterol medications, whatever the case may be, painkillers, anti-inflammatories, and sometimes those things are necessary. But if we can get the body, the central nervous system, which controls everything, clear, neural or structurally speaking, the body should work the way it's supposed to. It should increase function, and that allows the body to return to as close to normal as possible. And in our upper cervical chiropractic office, we find when we correct that area there, the majority of people's lives improve, and in a very high percentage of them, a very large percentage of the problems that they came in with have resolved over a course of care. So again, leave a comment in the comment section below if you're someone who's dealing with chronic health problems and you've been everywhere and you're your wit's end and this video has piqued your interest. We can find you someone in your area.